You are listening to You Restored with Dr. Kelley Reis. To listen to all episodes, visit libertynaturalwellness.com. On this episode of You Restored, let's get into autoimmunity. It is so super common for me to find people who have autoimmune issues. This is when your body fights itself. The immune system is set up to fight invaders, not yourself. Now, we all have a little bit of autoimmunity going on at any given time, a little confusion in the immune system. However, the amount of autoimmunity that I see has grown exponentially over my 22 years, for sure. I've always been interested in autoimmunity. I've always looked for autoimmunity, but the amount that I find now it's staggering. It's staggering how much autoimmunity that I find. Some of the most common autoimmune conditions, I would just say the most common autoimmune condition is in the thyroid. So Hashimoto's thyroiditis. That's specifically autoimmune thyroid. But over the years, I have seen so much autoimmunity. And whether it be lupus or Sjogren's or scleroderma or mixed connective tissue disorders, the body is attacking itself. In conventional medicine, it usually takes, it's more common in women by far, and I have a few theories on that. But it usually takes, when someone doesn't see a holistic doctor, it usually takes 4 doctors in about 4 years for someone to finally find the autoimmune issue. Standard general practitioners, it's not in my wheelhouse, let me refer you. So someone might be referred to a rheumatologist. And rheumatologists, for the most part, will only take it seriously if it's more of an extensive autoimmune condition. It's oftentimes brushed aside. Oh, that's not a high enough anti-nuclear antibody, which is the standard test for more systemic autoimmune issues. But it will be like, well, come back when it's worse. What's the standard client? I'm going to set Hashimoto's aside because I've talked about thyroid and I will talk more about thyroid in future podcasts. But the standard systemic autoimmune condition, I would say the top 3 symptoms that I see is fatigue, like pretty much debilitating fatigue. Joint pain, and maybe it's not always joint, but a lot of times it's joint. And constipation, of all things. Those 3, first thing I think of is systemic autoimmune. Now, you may be thinking, oh my gosh, I've got all of those. And it's good to get worked up for an autoimmune condition. But those are probably the 3 biggest factors or symptoms that I will see in somebody that I suspect autoimmunity, with the top 2 being the fatigue and the pain. Constipation doesn't always have to be there, but it is a lot. And I think that's pretty interesting. So it is missed. Fatigue, joint pain, and constipation, that gets blown off in conventional medicine all the time. Well, you're just getting older. Oh, you're in perimenopause. Oh, you're in postmenopause. Oh, you're a woman. Oh, it just gets blown off. So what is the standard workup in autoimmunity? First off, I run a CBC, a complete blood count, and what I will see in some cases, not all, is what is called pancytopenia. That is low white blood cells, low red blood cells, and low platelets. It's not always there, but if I see that on a regular CBC, I think autoimmune. And once again, systemic autoimmune, like the lupus, scleroderma, Sjogren's, autoimmune issues like that. On a standard panel for me, I run inflammatory markers, CBC, inflammatory markers like an erythrocyte sedimentation rate. I run clotting factors, C-reactive protein, but an ANA is kind of the standard autoimmune test. And that is anti-nuclear antibodies. Now, it is not positive for all autoimmune conditions. When I see positive, I think autoimmune. When I don't see it, I still sometimes think autoimmune based on the symptoms. So I don't need a test always to verify, but sometimes it does verify when I get a positive. Now, that ANA comes through as a titer, and that is a ratio. So you will see a number like 1 to 40. That number doubles as the autoimmune condition is a little more solid in that person. So 1 to 40 is considered negative. 1 to 80 is considered borderline, although they put positive there, but it's borderline positive. And beyond that, 1 to 160, 1 to 320, 1 to 640, 1 to 1280, and so on and so forth. The more that autoimmune condition is a solid feature in that person, and usually the worse that condition is. So when I see a 1 to 80 or higher, I'm wondering what else is going on in the body. I don't stop there. I think by now y'all know I don't stop with just, there's autoimmune. I don't need a name to it. A lot of people want that. So under an ANA, there are some confirmatory tests that can tease apart scleroderma from Sjogren's, from lupus. But to me, autoimmune is autoimmune. I'll run those tests for a client if they're curious, but I will tell you there are about, it's probably more now, but maybe 150 autoimmune conditions. Confirmatory tests, I think we have about 10 to 15 confirmatory tests. So that's 135 to 140 autoimmune conditions that we can't nail down with a name. To me, it doesn't matter. Autoimmune is autoimmune. What is going on underneath in those foundations that has allowed the body to get confused in the immune system? I do like to look at, childhood history, what happened, were there traumas as the immune system was developing, and look there. I obviously, guys, I'm going to look hormones, gut, dig deeper, always. One important factor that I find is estrogen dominance is pretty much universal in someone with autoimmune issues. Estrogen aggravates the heck out of autoimmune conditions. I'm not saying it caused it, but there is an absolute link with high estrogen or poor estrogen detox and autoimmune disease disorder severity. And it's well documented in research that estrogen plays a big role, which is why we see it in women more. So understanding estrogen dominance is really crucial. And then the gut microbiome, I don't think there's a person out there with an autoimmune condition that does not have leaky gut. Things getting through, talked about it before, things getting through the barrier, the gut barrier, out into the bloodstream, that immune system starts firing, gets very confused. What are these things? Why am I experiencing, these unknown things? And it starts getting confused, getting overreactive and getting confused. So estrogen and leaky gut are two huge factors. Theory on why, so autoimmune, as I said, it has become a bigger issue over the years. Definitely bigger since 2020, since the COVID era. Absolutely bigger issue than it was prior to 2020. But I have a pretty big theory as at least a huge player, and that is glyphosate. Glyphosate was considered safe for humans because the pathway that it uses is a pathway that affects, it doesn't affect, we don't have the pathway. And that is the shikimate pathway. So we do not have that pathway. That pathway, it's considered safe for humans. But guess what has that pathway? Gut bacteria. Duh. So while a human may not have that amino acid pathway, our crucial gut bacteria have that pathway. But not all of them have that pathway. So we are inundated with glyphosate residues. I don't care if you eat organic, you really need to look at things that are glyphosate, proven to be glyphosate free. Whether that's flour, even organic wheat has glyphosate residues on it. So inundated, we are, just inundated with glyphosate residues all over our food, in the air, if you're around farms. So glyphosate interrupts the shikimate pathway, but only in specific types of bacteria. Two big genera of bacteria that have they have this pathway and are significantly impacted by this are Lactobacillus and Bifidobacterium. These are keystone species crucial for our, I'm going to call it survival. But this glyphosate will get in and affect that pathway and render these two genera of bacteria unable to reproduce and flourish. So they die back, which leaves room for pathogens or opportunist bacteria to fill in that space. Lactobacillus, hugely important in all sorts of stuff. It will release lactic acid. It will kind of create an acidic environment that will keep competitors, bad competitors, opportunists, pathogens, those are bad guys. It will keep them from flourishing. It also plays a big role in histamine management. Bifidobacterium, the amount of things that Bifido group does, but also hugely important in histamine regulation. Not all of the Bifidobacterium are histamine regulators. There's a few that actually produce histamine. Histamine's important. It's histamine overload that is the problem these days that I'm seeing a lot more lately as well. So we're knocking back Lactobacillus. We are knocking back Bifidobacterium. There are a lot of pathogens and opportunists that are actually immune to glyphosate's effect on the shikimate pathway. So here they are left able to reproduce and flourish. So now we have dysbiosis. Now, there aren't big studies on Akkermansia. Akkermansia is the bacteria in the gut that's responsible for keeping that mucus layer, I call it the sealant, in the gut. It lines the gut. It's responsible for keeping that really strong and the integrity intact. So not a lot of research. I bet if they started doing deeper research in Akkermansia, we'd see glyphosate actually have a negative impact on Akkermansia as well. So we're knocking back good guys. We are allowing opportunists to steal our resources, pathogens, to do, harm, full on harm, and creating all sorts of dysbiosis. So when we have dysbiosis, we get less butyric acid. Butyric acid feeds the colon cells. It prevents cancer. It does everything good. So now we're getting low butyric acid, or butyrate. And here we're just, taking supplements, probiotics and prebiotics, but we're not even able to rebuild because we're eating glyphosate-laden foods. So I think glyphosate is playing a huge role. So glyphosate also upregulates zonulin. I've talked about zonulin in Leaky Gut podcast. Zonulin will literally break open the barrier of the gut. So absolutely creates leaky gut. Upregulating zonulin just breaks open the barrier and allows all sorts of lipopolysaccharides, which are bacterial fragments, any kind of, undigested food, toxins, gets into the bloodstream. Once again, I was talking about the amped immune response. The other interesting thing is that glyphosate/zonulin will actually also break the blood-brain barrier. So I always talk about the gut and the brain. I mean, it's like one unit, but that is in the research that glyphosate/zonulin is breaking the blood-brain barrier as well. So glyphosate's a real issue with autoimmunity by way of zonulin, by way of disrupting the gut. Yeah, it doesn't affect humans directly, but it affects humans directly through the gut microbiome and creating absolute dysfunction in the gut. So if you want to get a handle on your autoimmune conditions, or you want to even get, the testing, you need to find somebody who's willing to go the extra mile. Rheumatologists blow off those low titer numbers a lot. And, holistic doctors should delve deep into testing to better understand, but you've got to work on it through multiple levels. You can't eat crap and think that, your autoimmune condition is going to be better. We really need to look at this in every way possible to really get to the bottom of the autoimmune condition and to get your body to stop overreacting. I am Dr. Kelley. This is You Restored, and I hope you're able to get all that data that helps you get your answers.